Myself, Dr. Shambo Samajdar. I had done my MD and DM in clinical pharmacology. Apart from that, I had done my PG diploma in endocrinology and diabetes, and also fellowship in respiratory and critical care from West Bengal University of Health Science. I had done my fellowship in allergy asthma specialist course from International Asthma Service, now attached to Allergy Asthma Treatment Center, Moulali, School of Tropical Medicine as clinical pharmacologist, and also consultant at Diabetes and Allergy Asthma Therapeutic Specialty Clinic at Kolkata. So welcome you all. Today we are going to discuss about a very important and concerning issue, that is raised blood pressure or hypertension. There was a data in 2016 that 16 lakh Indian died due to hypertension or related morbidity. Why hypertension is important? Because it is a silent killer. Without producing symptoms, it will produce multiple complications that include damage in your eye, damage in your kidney, stroke or other cardiovascular death, renal complications which lead to dialysis. So I am not here to make you afraid, but here to aware you regarding the hypertension. So first of all, we need to understand what is blood pressure. So we all have certain blood pressure. Blood pressure defined by our physiologist, that when each time heart beats and pumps blood into the blood vessels, this blood exerts certain pressure in the walls of the blood vessels, and that pressure is called as blood pressure. So if this blood pressure is high, we can define it as high blood pressure or hypertension. There is certain cutoff we need to understand. In general, according to ACC/AHA and a very recently published RSSDI guideline, if our blood pressure is less than 120 systolic blood pressure and less than 80 millimeter of mercury diastolic blood pressure, then it is normal. So when we are talking about systolic and diastolic blood pressure, generally for persons who are not medically educated, there is one higher threshold and one lower threshold. That means something by something. So we call it as 110 by 70 or 130 by 80, like that. But the upper part, that means the 120 or 130 or 110, that is the systolic blood pressure, and the lower part, that is 80 or 70, that is the diastolic blood pressure. So if my blood pressure is, the systolic blood pressure is less than 120 and diastolic blood pressure is less than 80 millimeter of mercury, then I do not have hypertension. I am normal in terms of blood pressure. So when it is between, the systolic blood pressure is more than 120 but less than 130, so between 120 to 130, and diastolic blood pressure is less than 80, then we can call it as elevated blood pressure. So that is the time we need to be alarmed. And when our systolic blood pressure is 130 or more and diastolic blood pressure is more than 80, then as per the ACC/AHA guideline 2017 and current RSSDI guideline, we are hypertensive. There are lots of hypotheses, lots of data which suggest when we enters into the doctor's clinic or office, our blood pressure sometimes raised, and that is called as white coat hypertension. So for office, in some literature, we had a cutoff of 140 by 90. So if it is more than 140 by 90 millimeter of mercury in office, that means in doctor's chamber, then we can stamp those patients as hypertensive. But with normal physiology, our circadian time, that is 24-hour cycle, we have a variation in our blood pressure. Morning time blood pressure, evening time blood pressure, night time blood pressure, and sleeping blood pressure all have different cutoff. In general, to remember easily, if my mean blood pressure at home is more than 135 by 85 millimeter of mercury, then I have hypertension. If my morning blood pressure is more than 140 or rather 130 by 80 millimeter of mercury, then I have hypertension. Whereas normally the nighttime blood pressure should reduce. So that is called as nocturnal dipping. And if it is not happening, then I have some problem. So generally, nighttime blood pressure should be less than 120 by 70 millimeter of mercury. So these numbers we need to remember, because blood pressure is something which we can measure easily at home. There are lots of validated, calibrated devices are there in the market. Automatic BP machines are there. You have to check the validation and you can buy that. And you can check your blood pressure, you can check your relative. There are certain important issues while we are talking about hypertension. There are certain risk factors we need to visit. What are those risk factors? Number one, age. Obviously, it is something which we also cannot modify. So with increasing age, our blood pressure will rise. So if I am in 40s, in 50s, in 60s, we should be more vigilant in checking our blood pressure. Second important thing is that the family history of high blood pressure. So if my father, my mother, my grandfather or my relatives have history of high blood pressure or sometimes have history of bad cardiovascular outcome, we need to be extra cautious in measuring blood pressure. Third important point is excess salt intake. If I am consuming excess salt, I have more chance in developing high blood pressure. And sometimes it is very important to remember that salt is not only present in form of salt, it also present in different food items that we often consume, like achar, like some chanachur. We need to avoid those because those food items are very detrimental for our health too. Then we should also be aware that we should eat more potassium rich food, that is the fruits, different fruits, because if I am not consuming foods which are very high in potassium, I am having the risk of developing high blood pressure. Then in this era of always running the e-era, online era, the problem is there with our food items. As we have less time, we often eat processed food, and this type of processed food is very detrimental for our health. The trans fat, the food will look nice, but actually they are not going to have a nice impact in our physiology. They are going to increase our blood pressure. Then another important issue is that our sedentary lifestyle. If I am just like this, sitting and sitting, this sitting is now considered as new smoking. Just like smoking, this sitting habit is very bad. If I am consuming alcohol more and more, then also I am at risk. And also we need to understand another S that often we not recognize, that is stress. In this lifestyle, the stress is very common associated with us. We need to avoid stress. We need to do something to overcome this stress. So these are few important issues that can be considered as risk factors of high blood pressure. So now at the end, I just want to re-emphasize what we should do to prevent hypertension or high blood pressure, and if I am not having high blood pressure, how we can prevent developing hypertension or high blood pressure. So first of all, we need to manage the hypertension properly, because hypertension will kill us, will complicate our life. And secondly, it is important to prevent development of hypertension. Why? Because even if I am taking drug, I am having a very good blood pressure control, it had been seen that my blood pressure, if it was elevated some before and now it is controlled with medication, the outcome to me, the mortality, morbidity chances to me is much more higher compared to those who does not have high BP. So even my blood pressure is controlled, and I am having the same blood pressure or less blood pressure compared to someone who does not have blood pressure, but I have more chance of cardiovascular morbidity and mortality. For that, we should have a primary prevention strategy to prevent development of hypertension or high blood pressure, and for that we should have a regular exercise. So at least 30-minute brisk walking is important, and for that 3 to 6 kilometers per hour for 30 minutes. This walking could help us immensely, and if we can increase the duration of walking from 30 minutes to 1 hour, nothing like that. Next is healthy diet. So we need to restrict the salt intake. We need to increase the food items which are rich source of potassium. We need to ban those food items which are processed food. We need to avoid the meats, specifically the fatty meats. We can consume lean protein in terms of fish, but we should avoid those trans fat. And of course, we should quit smoking and reduce alcohol intake. And there was a very important study which suggests even with less alcohol intake, the Southeast Asian population has had worse outcome. So it is always better to avoid alcohol if you are belonging to the race of Southeast Asia. Next is the monitoring is important. Often we took medicine but forget monitoring. As already we had mentioned high blood pressure is something which can kill us silently, it is very important to monitor our blood pressure, whether my blood pressure is under control or not. That is very important. And generally the target blood pressure is less than 130 by 80 millimeter of mercury. That target we all should remember. And of course the stress management is important, and for that stress management we need to revisit something called as yoga, because yoga is an excellent tool which can reduce more. And when we are called yoga is something that means addition, and always we talk about we, not I. And yoga is something which make multiple I to become we. So yoga can help us from transformation from illness to wellness, because we are transforming from I to we. So that is very important, yoga. Apart from that, our sleep should be adequate. We often forget about our sleep health. There was a clear-cut guideline now by American Diabetes Association. They are suggesting that we should have optimum sleep, and that is between 6 to 8 hours. So more than 8 hours is not good, less than 6 hours is not good. And the 6 to 8 hours sleep also, that should be a sound sleep. The timing of sleep is important. We should not have some breathing difficulties patterns during our sleep, often known as obstructive sleep apnea. So we need to check whether ask our partner that whether I am snoring at night. Sometimes whether I am very much weak during our daytime and doing some other job, I may feel sleepy. So these are some important concerns while we are talking about sleep health. So we should not have obstructive sleep apnea. Another important issue regarding the sleep is the timing of the sleep. We should follow the early bird, not the old owl, because we all know the owl generally awake during night time, but early bird goes to bed early and wake up early, and that is actually the chronophysiology. That is actually we need to follow the old rhymes which was suggesting early to bed and early to rise makes a man healthy, wealthy and wise. And when we are talking about any chronic disease management, the adherence is something which is very important. And what is that? Adherence to therapy, adherence to medicine. If I am forgetting to take medicine, then how medicine will work? So if I am not consuming a medicine for certain indication, that indication will not be solved. So very simple. So we should not forget to take the medicine. I believe this is a very difficult issue when we are dealing with our elderly friends, our geriatric population. They forget to take medicine. So there should be a support for those people who are forgetting the medicine, and for that there are different now different technologies are available to improve the adherence, because adherence is a key to have a successful therapy. So with that, I want to finish here. I want you all should have a life without any complications associated with hypertension, and many of you should not develop the high blood pressure. If you have high blood pressure, or elevated blood pressure or even normal blood pressure, don't forget to monitor your blood pressure regularly. Don't forget, if you were prescribed some medications, don't forget to take those medications regularly, and do not forget about your lifestyle modifications, because lifestyle modification does not have any alternative, and we all should follow that. In this era when obesity pandemic, we talked about COVID-19 pandemic a lot, but we forget about this obesity pandemic. We always should measure our pant size, because this abdominal circumference is important. If your abdominal circumference is more, if you are male, if it is more than 90 centimeter, and if you are female, if it is more than 80 centimeter, you are having the risk of all metabolic syndrome related illness, including high blood pressure or hypertension, including diabetes and cancers. So check your pant size, whether it is going up or not. Don't rely only on your body weight or BMI, and try to reduce your abdominal circumference. So next puja, when you are going to buy your new pant, I wish that you have a lesser sized pant, lesser sized abdominal girth, so that you will have a healthy life ahead. With that, wish you all a happy new year 2023. Thank you very much.